It can start with something as simple as a cough, one that just won't go away, and you can lead to a diagnosis that pretty much changes everything. So today, we're going to break down the complex world of lung tumors. We'll follow the whole journey from those very first signs all the way to the modern treatments that are really changing the odds. Let's get into it. Right? This is the question. It's so often where it all begins. A nagging cough that hangs around long after you figure a cold should be gone. For a lot of people, this is the first little clue that kicks off the search for answers, and it's the perfect place for us to start our exploration. Okay, so before we dive any deeper, we have to get one really critical thing straight. The word tumor itself, it can be pretty scary, right? But here's the deal. Not all tumors are created equal. And understanding the difference between benign and malignant is, well, it's the foundation for this whole conversation. So what even is a lung tumor? At its most basic level, it's a clump, a mass, formed by cells that have basically forgotten the rules. They don't know when to stop growing. But honestly, the really important question isn't just what it is, but what it's capable of doing. And this slide lays it out perfectly. You've got two very different paths these growths can take. On one side, you have benign tumors. They're usually slow-growing, they have neat, defined borders, and, this is the most important part, they stay put. They don't spread. But on the other side, you've got malignant tumors. That's what we call cancer. And they're the complete opposite. They grow fast, their borders are messy, and they have this dangerous ability to metastasize, which means they can spread to other parts of the body. That single difference, well, it changes everything. So that brings up the next obvious question, right? What makes these cells go haywire and start growing out of control in the first place? Let's take a look at the major risk factors. Just let that number sink in for a second. A massive 85 to 90% of all lung cancers are directly caused by smoking. There's just no way around it. It is, without a doubt, the single biggest cause. The connection is undeniable, and it's the most important piece of the prevention puzzle for sure. But, and this is important, smoking isn't the only cause. Other things absolutely play a role. Being around secondhand smoke, living with a lot of air pollution, or being exposed to stuff at work like asbestos and radon, those all increase your risk. And then you've got things you can't control, like your family history or having other chronic lung diseases. Okay, so let's say a symptom or a risk factor raises a red flag. What happens then? This is the part of the journey where we go from that first, what's this moment to getting a definitive answer. The tricky thing is, the early warning signs are often really subtle. You might just mistake them for something else. A cough that just hangs on, feeling out of breath more easily, some vague discomfort in your chest, or feeling super tired for no reason. The key word here is persistent. These aren't things that just go away in a couple of days. What's really cool is how the whole diagnostic process works like a funnel, getting more and more specific. Doctors usually start broad with something like a chest x-ray, just to see if there's a mass. If they find something, the next step is a CT scan, which gives a much clearer, more detailed picture. Then a PET scan can see if it's spread anywhere else. But the final, absolute confirmation, that's the biopsy. They have to take a tiny piece of the tissue and look at it under a microscope. That's the only way to know for sure if it's cancer. So, once cancer is confirmed, the next crucial step is something called staging. And this isn't just about giving it a label. It's like creating a map that tells doctors exactly how far the cancer has progressed, which is absolutely essential for figuring out the best way to treat it. And the universal language that doctors all over the world use for this mapping is the TNM system. It might just look like 3 letters, but those letters pack in all the key information about how advanced the cancer is. Let's just quickly break it down. T is for tumor. Basically, how big is the main tumor? N is for nodes. Has it spread to any of the nearby lymph nodes? And M's the big one. It stands for metastasis. Has the cancer traveled to distant places in the body, like the brain or the liver? And all of that, the T, the N, and the M, comes together to give you the stage. To keep it simple, just look at the 2 extremes. In stage I, the cancer is small, and it's stuck right there inside the lung. But by the time it gets to stage 4, it has metastasized and spread to other organs. As you can imagine, this staging has a huge impact on treatment options and a person's prognosis. All right, so now we have a diagnosis and we have a stage. The focus completely shifts to treatment. And this is where we get to explore the incredible and increasingly personalized tools that doctors have in their arsenal to fight lung cancer. The first thing you've got to know is that lung cancer isn't just one disease. It's really split into two main types, and just look at the difference here. Non-small cell lung cancer, or NSCLC, accounts for about 85% of all cases. The other 15% is small cell lung cancer, or SCLC.
And these two types behave very, very differently. NSCLC, the more common one, tends to grow and spread more slowly. SCLC, on the other hand, is a whole different beast. It's super aggressive, grows really fast, and a lot of times it has already spread by the time it's even found. Because they're so different, the treatment strategies have to be different too. That's why surgery is often an option for NSCLC, while SCLC usually responds better to chemo and radiation.
So yeah, treatment is never a one-size-fits-all thing. Doctors have this amazing toolkit. You've got the classics, surgery to physically cut out the tumor, and radiation and chemo to kill cancer cells. But what's so exciting is that in recent years, we've seen these two revolutionary approaches come along. Targeted therapy, which zeroes in on the cancer's specific genetic weaknesses, and immunotherapy, which actually turbocharges the patient's own immune system to go fight the cancer. It's incredible stuff. Okay, let's wrap this all up. We've gone from the causes to the diagnosis to the treatments. Now let's look at the factors that really shape a patient's future and talk about the ultimate power of prevention. A person's long-term outlook, their prognosis, it really depends on a few key things. The stage of the cancer when it's first found is probably the most important factor. But the specific type of tumor matters, the person's general health going in, and of course, how well the cancer actually responds to the treatments, it all plays a huge role in the outcome. Which leads us to maybe the single most important question in this entire explainer. When you boil it all down with everything we know about this disease, what is the one thing that gives a person the absolute best chance? The answer is so simple, but so powerful. It's early detection. Finding the cancer at an earlier stage, like stage 1, when it's still small and hasn't spread, that makes every single treatment more effective and dramatically improves the chance for a cure. Honestly, it changes the entire game. And that leaves us with this final thought. The most powerful weapons against lung cancer aren't always found in a hospital. They're prevention and awareness. Quitting smoking is by far the number one thing anyone can do to lower their risk. Avoiding other known carcinogens helps too. But just as important is awareness, knowing the symptoms. That persistent cough we talked about at the very beginning, that's not something to just brush off. Getting it checked out is the very first step toward early detection. And as we've just seen, that makes all the difference in the world.